I think a lot of times in medicine, we tend to tell people what to do, right? We're like, here's your problem, here's the solution. But in lifestyle medicine, you kind of think about the fact that, of course, the medical recommendations will be made by us. But the solution to, okay, well, I'm just really not getting to the gym, and being able to kind of ask them, well, where do you think this fits in, is really helpful for them to be the guy, the person driving the car, and we're there to guide them. So that is something that is really feasible in this type of model that I really enjoy.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel. Welcome, everyone, to the Pinnacle Prescription Podcast. I'm your host, Dr. Rupa Wong, and today I am joined by Dr. Richa Mittal for Thinking Outside the Box Direct Care Practice. Dr. Mittal is the founder and medical director of Radiant Health. It is a direct membership-based obesity and lifestyle medicine practice. She is a board-certified internal medicine physician and also a diplomat of the boards of obesity medicine and lifestyle medicine. So we have so much to talk about with her, and I just can't wait to get started. Thank you so much for being here today, Richa.
Oh my gosh, thanks for having me. This is the topic that I love to talk about, so I'm super excited for our conversation.
And we're going to address it from both aspects because I think both sides of it are going to really be something that I think our listeners are going to enjoy. So let's just dive in. What inspired you to start your own direct primary care practice? I mean, it's kind of scary. It's very scary starting a practice, especially one that's a DPC type practice. And it's also a little scary to be thinking outside the box in the way that you have been doing it, where you treat your patients holistically. So what initiated this big change?
Yeah, it was absolutely scary, uncomfortable, unsettling. But I think what really inspired me was I wanted to practice medicine in a certain way. And I felt like through the years, I started working as a hospitalist when I first finished internal medicine residency. And, it was fast paced, it was exciting. There were all these really complicated medical issues, but I didn't really eventually feel fulfilled in that because I felt like my passion was on the preventative side. And I also felt like I wanted to build more meaningful relationships with my patients. And even though what I was offering in terms of care was really important in the acute hospital setting, I didn't get to actually see that person through the problem and after. And as far as like being able to provide more of my time and to actually talk about my patient as a person and what are the things that they're struggling with and connecting their medical health with their lifestyle, with who they are, what's important to them. Those things eventually, as I evolved, really became very important to me as a physician. And I thought that the direct care model would allow for me to be able to have more time, more access with my patients to really kind of get to the root cause of a lot of their struggles. And of course, using medical and lifestyle and evidence-based medicine to really treat them as a whole person. And I wanted to be my own boss. I was really kind of tired of, I think it's great to be employed. Obviously, there's good and bad on both sides. And definitely on my harder days, I have regrets, and I go, oh, I wish I just had a job and I could just go in and come back out and not worry about it. But I love the flexibility. I love being able to kind of decide what I want to do, take time off sometimes when I want, that I'm able to do by just blocking my schedule. And then last but not least, just being able to come up with an idea and implement it right away. And trial and error, and something works and something doesn't. I'm very creative, and I felt like having my own practice allowed me to also delve into some other aspects of myself. So yeah, that was I think I answered a lot more than what you were saying, but what
I
inspired
love
me
it.
was all of that.
All of it. Well, there's so many things that you touched on, but first, of course, taking a preventative type approach, which now is starting to become a lot more popular as people look for other therapies that might benefit them. So I think that's great that you encountered that and you discovered it for yourself and for your patients so early on. And I totally agree. The flexibility of being your own boss. I mean, here I am not in Hawaii because I can take the time off to be with my kids, but it does have that con side. We've got fires to put out in the office. There are things that are happening where it's a lot more sometimes that you really have to manage and think about constantly, right? Sometimes you don't sleep at night because you're worried about X, Y, and Z. So
Yeah.
I everything you just said resonates so much with me. And what I really like though is when you are talking about the preventative aspects, you also discuss the social, the emotional, and the lifestyle, not just the lifestyle, right? Elements of your patients' lives. So, how do you integrate all of that into your practice? And I do think that having a direct care model seems to be much better to be able to do that than like 15-minute time blocks. But how do take a step by step? How do you actually integrate that for your patients?
Yeah, it is a lot. And, you have to know upfront yourself and set up expectations for your patients too, that a lot of the things that they're struggling with are going to be things that we're going to work on together over time. And I think developing that relationship and that trust right off the bat is really important. And communication, being able to explain this is the whole process. I usually work with people over time, so I'm not going to just see them one time. So I know that in our initial visit, we're going to be able to, of course, gather a medical history, and I do a very detailed nutrition and lifestyle assessment that does talk about their own personal stressors and sleep issues, which are very common. Who lives in the home, who's doing the grocery shopping, who does the cooking. There's so many aspects, but lifestyle medicine is about treating the whole person. And of course, we all want to do that as physicians, but being able to delve into their social relationships, their mental well being, their physical activity, nutrition, avoiding risky substances like unfortunately alcohol is really commonly used amongst many people, kind of being able to address all of those in a framework and also being able to personalize it because again, everyone kind of knows what they should be doing, right? I mean, it's not usually a knowledge issue. Of course, sometimes there's a lot of myth busting for things that someone might have heard about on TikTok, and they're like, is that true? And actually, no, you can eat some carbohydrates. Here's the ones that have more fiber. But, really being able to pinpoint where their areas of challenges are in all those areas is something that happens right off the bat at the first visit. And I like to give everyone what I call a first visit action item. Like literally, we lay the foundation. So I call it a foundation visit, the first visit. And we spend about 75 to 90 minutes. Part of that is, of course, their medical, checking their vitals, doing their body composition. But a lot of it is really spent talking about reviewing their history, reviewing all those areas in that intake. And then over time, being able to, at every single visit, address maybe two goals that they set at their prior visit to understand where their challenges were, what went well, what didn't go well, what do they envision the solutions are. I think a lot of times in medicine, we tend to tell people what to do, right? We're like, here's your
Mm-hmm.
problem, here's the solution. But in lifestyle medicine, you kind of think about the fact that, of course, the medical recommendations will be made by us. But the solution to, okay, well, I'm just really not getting to the gym and being able to kind of ask them, well, where do you think this fits in? Is really helpful for them to be the guy, the person driving the car, and we're there to guide them. So that is something that is really feasible in this type of model that I really enjoy.
That's so interesting because I was going to say, all right, now that I am close to 50 and I'm going to my own PCP and I have medical problems, this approach sounds so wonderful, but I think I would also feel really overwhelmed. Like, I know what I should be doing, but actually instituting those practices is hard. And I love what you said, that you create these goals so it doesn't feel you're chunking it up, right? So it's easier for people to start integrating it, and they're the driver. They decide what is it they want to focus on, and you're not telling them you need to cut the carbs or you need to do this or you need to do that, because usually that doesn't go well. So that kind of leads into
Right.
my next question. Because maybe I would be your difficult, challenging patient. Um, what are the obstacles, especially with obesity medicine and lifestyle medicine? What are some unique, some obstacles that you typically see with your patient population?
So I think perfectionism is one that a lot of people, a lot of us struggle with. And, anytime people start to think about, oh, I'm going to turn a new leaf today, or it's January 1st and I'm going to do all these things perfectly. I'm going to eat right. I'm going to work out. I'm going to get 8 hours of sleep. I'm going to give up everything bad, quote unquote. That's not feasible really to sustain, right? So I think it's really important to give people permission to not be perfect right up front, because not only are they expecting it of themselves, but they also don't want to disappoint me. Or they might feel like, oh, I've put all this, investment into this program and I'm falling short. And, therefore I should just kind of go away and maybe not go come to my appointments. And so I think really recognizing, hey, you know what? You don't have to be perfect and you are going to stumble. And what are the roadblocks that you've specifically faced? And let's come up with a plan of action for when that happens and we'll figure it out. So I think perfectionism is one. I think the other is some misinformation. So because there's so many trends and people, search for information in so many places. There's a lot of complicated people with complicated relationships with food, which is a big problem because, we all deserve to have a balanced approach and indulge when it's appropriate. And again, when the messaging has been, all X is bad, that doesn't really kind of goes along with perfectionism, but also we want to recognize that, a lot of times people who've struggled with weight have dieted their whole lives and they very well face the challenge of a not so great relationship with food or maybe with body image. And then, of course, the misinformation, which just piles up on top of it. So I would say those are probably the top three obstacles. Of course, practically speaking, time limitation. We all have so many things that we want to be able to focus on. And I know you talk a lot about time management, but it's sometimes really hard, right? People are working, they have families, and they're like, I just don't have time to really cook out all my meals or to go to the gym for an hour every day. And I think being able to say something is better than nothing. And if you can just say, hey, let's build on this, not only do you gain confidence, it becomes a habit, but you make progress because the perfect, effort is not sustainable, but also one that may not be possible and keeps you from even growing at all in any area.
Or starting. I mean, that's it's so interesting because I've realized as I'm here just with my daughter in California, my husband's at home with the boys, and I thought about it and I realized, okay, usually I cook, but it tends to be more elaborate meals and things that I'm trying to, it takes a lot of prep. And it doesn't have to be. I can still get them. They can still even just eat some baby carrots or just carrots with, it's okay for it to be simple. And sometimes that then makes it easier to sustain it, right?
Absolutely. Yeah.
So you were mentioning about some of the obstacles, and I know this is a trendy topic and trends and misinformation that's available online. How has the introduction of semaglutides and GLP-1s really affected your practice? Do you find that patients just want it as a quick fix and that are unwilling then to do the other aspects? Or how do you convince them to do both? Or is that really not an issue? They come in knowing I've got to also manage the diet and the nutrition and the this as well. Like, let's address that.
Yeah, no, that's a good question. So I've been prescribing semaglutide for years. A lot of us obesity medicine doctors were already kind of prescribing these off label before. And then luckily they were approved for the weight management indication. But there's lots of people with pre-diabetes and metabolic syndrome who are now at least being able to kind of take advantage of the medication on label. But as far as like whether there's going to be work to be done versus is it as simple as taking a shot once a week, I think that I attract people who are wanting to do some work and understand that it's not going to be a quick fix. They're probably going somewhere online or to a med spa, to be honest, and maybe just getting a prescription. And I understand that we want things to be simple. But people who do better are going to be the ones who meld lifestyle with medication. And not only for their successful weight loss, but also for their overall metabolic health. And we want to be able to maintain muscle mass. And that's a big problem with these medications if they're not being counseled properly, say on adequate protein intake, on actually doing resistance training. Like that's a very important element in preserving muscle mass. Changing health habits and your perspective, learning the systems for simple meal prep, all of these things. And you can't, ignore the basic foundations of your health and just think that a shot will do the trick. Because if you're not sleeping and you're getting 3 hours of sleep a night, you're going to be tired all the time. You're not going to feel well. You're not going to feel the energy from adequate sleep and being able to, get physical activity again, not just for weight loss, but for longevity, for flexibility as we age to maintain your muscle mass. So, whether it's other FDA approved medications or if it's semaglutide, all of them, people do better when you have intensive lifestyle changes in addition to medication.
So well put, and exactly what can be hard to hear, but is so necessary.
Yeah.
And the fact that you've been doing this for so many years, not just a year or two, since all of these got approved for their other indications. So you must have then a ton of just wonderful success stories where you've been able to impact a patient's life truly in a very different way than other physicians are and have made that difference for addressing their lifestyle changes. Would you mind sharing one?
Yes. So I have the privilege of working with amazing patients. Like, we see each other every month. We get to know each other. Eventually, they go into where I see them every 3 or 6 months in the maintenance program, which is so important for long-term success. So one patient comes to mind who actually recently shared her story as a video testimonial, and I was just so moved by what she said. But she was a woman, mid 60s, really kind of having the history of like putting herself last. And I think there were a lot of, psychosocial stressors. And when she came to me, we diagnosed a lot of health issues. Pre-diabetes, high cholesterol, hypertension, fatty liver, obstructive sleep apnea. She was having these weird palpitations the first time I met her. And so we decided, like, let's do some evaluation and, kind of got to the bottom of it, which was she felt like, she wasn't choosing herself. And what we framed it as is like little chunks, and all those different areas that we talked about. And whether medication is used or not, that is important. But in this case, it's both strategies used, and amazing success. And when I say success, I mean she felt great. She felt like, there are all these things that I've been doing in my life that weren't serving me. And say, for instance, wine, that's a common self medication, we could say. And, it does the job in the moment, but it really wasn't serving her. And, minimizing alcohol, reframing indulgent food and thinking about what is the foundation of what I do every day. And we figured out really kind of like easier ways to meal prep. And getting things that are ready made, that goes to that perfectionism. There's nothing wrong with frozen vegetables, you know, or or pre-cut vegetables, or
Exactly.
yeah, or getting a meal service. Whatever you need to get the right things on your plate that serve your health. So really just focusing on becoming more nutrient dense, thinking about what do I get out of physical activity? What makes me feel strong? How can I prioritize sleep? And of course, treating sleep apnea medically, treating the weight gain medically, in addition to seeing resolution of liver enzymes that were elevated, resolution of sleep apnea, less blood pressure medication. Those are all wins. And you'll notice I didn't even really mention how much weight she lost, but that we
Mm-hmm.
always talk about the fact that yes, there was that, but there were all these other things that she gained,
Mm-hmm.
including
I
muscle.
love that. I love that. That was almost like an afterthought. I mean, because the other parts were the more important ones. How did you convince her? Because it sounds like the crux of it was she was putting herself last.
I
How did you
think
convince her to put herself first?
I
Because I
think
think
it
a lot
was
of us, as just women in medicine, struggle with that.
absolutely. I think during our conversations, it was an epiphany of her own to say, why is it that I haven't been doing a lot of these things that I knew I should be doing? And I think it's because we all have maybe different awareness of what our actions are every day, right? Uh, Sometimes we're not pausing to even think because we're just go, go, go. And so that epiphany kind of came from discussions in the exam room.
Oh, she came to it. She came to it
We
because
all
you
have
led
to
her
come to
there.
it ourselves, right?
Mm-hmm. Oh, that's so good. All right, shifting gears just a little bit. I know that you also offer practice consulting because a lot of people want to be able to have time with their patients. They want to be able to engage in a deeper and more meaningful way, the way that you have. And you've been helping other physicians and other healthcare providers to starting their own direct care practices. So, what are the top tips that you give them, especially when offering holistic care the way that you do?
Yeah, it's tough in the beginning. It's like a mind game, right? You just have to know. I've done hard things before, but we don't really learn, like you've started a private practice. We don't learn anything about this
Nope.
when we're doing our training, right? So
Nope.
I think being comfortable with being uncomfortable is really important skill, and maybe trusting that you're smart and you'll figure out an answer, or if not, reaching out for help. We don't have to reinvent the wheel over and over when we have other people that maybe have figured out some things and that can give you a resource. So I would say don't do it alone, like on an island. We're all connected, we can all help each other. And then, just I think trusting the process a little. I do think in a direct care model, and especially going outside the box, things go a little slower. And I don't mean slower as in maybe, that can look different for people, whether it's attaining patients, whether it's, hitting financial goals. That is one aspect I think that's a little different between an insurance-based model that, from what I hear, it seems that those kind of grow a little bit faster. So this one, you're doing something outside the box. So it's on you to show people the value of what you offer. And don't be afraid to charge what you think your services are worth. That is a hard one I had to learn myself because I was undervaluing what I did for people. And I think that a lot of people tend to do that.
Absolutely. We absolutely, especially I think women in medicine tend to undervalue what we do and what our services are worth. And that's fantastic that you help counsel on that front. That's wonderful. We're going to be changing so many lives, and we're changing slowly the way that we can help people and patients, which is amazing. How do you see, just in general, then, as you've been helping more and more people? I seem to know more and more people that are offering direct care. How do you see the direct care model evolving? What do you think, how's that role going to play in the broader healthcare landscape?
I think it's an interesting time because we have so many different models right now. We have our insurance base, we have direct care, and then we have a lot of people that, are kind of medicine adjacent who are also trying to offer services in that wellness holistic space. But I think that as physicians, and I'm in a lot of different physician Facebook groups, DPC groups, private practice groups, and I feel that there's more and more of us who want to really work for ourselves. And with more and more practices, say, being bought over by, private equity groups and hospital groups, sometimes that burnout and that you know uh, dissatisfaction in medicine is happening, and I think DPC and direct care type of models like this are giving some of us hope, like, hey, I don't just have to give up medicine because I can't practice this way. And I feel hopeful in that area. But one of the things that we have to think about too in that is your model has to be different. So, if you have a lot of overhead and you kind of get burdened down with a lot of that because you do know that, hey, you know what, this is going to grow slower. You're going to be facing the challenge of convincing people of a different model that they're not familiar with. Uh, Tying yourself down to a lot of overhead and things like that, it can make it very challenging. But yeah, I think overall, I see that there's going to be more and more DPC type of practices. And I think that's a great avenue for a lot of people who may be burned out in certain areas of medicine, but still want to keep that passion alive and want to be able to practice on their own terms.
I love it. It's so many encouraging words for people who might be contemplating this, but also just that knowledge that there's help there. There are other people who have done it before. And even though you are creating something unique and different, you don't have to do it alone, which is such an empowering message, I hope, to many people who are listening. All right, now tell us, what is your one pinnacle pearl to share with other women in medicine?
I'm going to say it's progress over perfection. I struggle with it. I know most of us struggle with, we're so used to just being good at what we're good at. And, when you start out doing something different or new, or you're learning a new skill, whether it's a direct care practice or putting ourselves on social media or, you know, uh, writing a book, whatever that is, I think that if we can go in just knowing, hey, I'm making progress over being perfect. If you are imperfect, you're going to fail. I always tell my kids, I fail every day and I learn from it and I move on and I do better the next time. So that would be my pearl is measure your progress, not being perfect.
So good for people if they are in medicine, or even just if they are trying to make those changes in their life the way that you said. It just touches on so many of the things that we talked about for the last 30 minutes. So as we wrap up, because we are running out of time, where can people find you, online or physically? Share all the places.
Yeah, so physically, I'm in the suburbs of Dallas. I serve patients all throughout Texas. And online, I'm on Instagram, TikTok, Facebook at Richa Mittal MD. I also have a website where I share a lot of resources. It's richamittalmd.com.
Wonderful. Thank you so much, Richa, for being here today. I learned a lot. I think it's going to feel really empowering to many people to hear what you have to say, how you've built and created the type of practice you have, and how you've helped your patients in so doing. So thank you so much for being here today.
Thank you for having me.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.